In Chapter 15, we are going to cover disorders and conditions resulting from trauma. So we're going to start this lecture by discussing open trauma. And open trauma can involve only the skin surface, or it may actually extend to the soft tissue and structures that are deep below the skin surface. And it may be in the form of an abrasion, in which the skin surface is scraped away, or it may be an avulsion, in which the tissue or an appendage is actually torn away. And the injury can involve only a small area, like we see in puncture wounds. It can be a little bit larger, like we see in an injury caused by a bullet wound or something like that. Or it can encompass very, very large areas, like the injuries that result from crushing injuries, like if you get stuck underneath a machine or you get ran over by a car or something like that. All incidents of open trauma have a commonality. They all carry the risk of infection if the wound is not appropriately cleaned and dressed. And pain is also involved in most open trauma. So open wounds can be the source of tetanus infections. So therefore, a tetanus prophylactic must be provided. So I'm sure many of you have gotten a tetanus shot. If you have not gotten a tetanus shot, it is recommended to do so. And you should be getting a tetanus booster every 10 years. And especially if you are working in the construction industry, or if you're just in an old house where the floorboards are coming off and you step on a rusty nail or something like that, it's important to go get a tetanus shot to make sure that you don't get the tetanus reaction going on in the body. Bleeding can be another factor in open trauma, and it must be immediately addressed. Some injuries need only basic first aid, where others require medical intervention, stitching, and other types of surgical repair. But regardless of the severity of the injury, we need to address the injury, treat it appropriately, and make sure that we get the best healing protocol in order to lessen the potential for scarring. Orthopedic and neurologic traumas, we've talked about those already, so I'm not going to go into those, but we're going to talk more about the open traumas and things that we get from puncture wounds. Crushing injuries occur when part of the body is compressed with extreme force between two surfaces. And this is commonly seen in people who are working on the assembly lines or working on heavy-duty machinery, where they are making different types of components for cars. If you are not paying close attention to what you're doing, you can suffer from a crushing injury, and that's depicted in the picture on the screen here. So it can involve any body part, but most often it usually involves a finger, a hand, a toe, or a foot. And the patient's going to experience extreme pain. As you can see in the picture, these injuries look very, very painful, and the patient may not be able to move the injured part. So the soft tissue is going to be compressed or crushed, and depending on the amount of pressure involved in the mechanism of injury, we may also get damage to bone, nerves, as well as blood vessels. So any type of crushing injury, this requires immediate and prompt medical assessment and intervention. So you need to go to the ER and get evaluated immediately if you have experienced any type of crushing injury. So the diagnosis is going to be made on the basis of the history, the visual inspection of the area that is experiencing the crushing injury, and also the physical exam. And then the physician may order other types of diagnostic exams to look at the severity of the damage. So the physician may order different types of radiographic studies to help aid in the diagnosis. So the prognosis really depends on the extent of the injury. Like we see in these two pictures here, we see a lot of damage. So who knows, maybe the patient will never recover feeling or movement to those particular areas, or the patient may heal very well. So again, it really depends on the official physician diagnosis and what is actually going on as far as nervous innervation damage as well as perfusion damage. So OSHA outlines different guidelines. OSHA is the Occupational Safety and Health Administration. So these guidelines are outlined in order to provide healthcare personnel with guidelines so that they could lessen the risk of occurrence of different types of injury, especially when people are engaging in high-risk activities. High-risk activities in the healthcare field include dealing with people who have bloodborne pathogens, bloodborne disease, and the people who could potentially suffer from contaminated needle sticks, like doctors and nurses. So contaminated needle sticks are something that you have to be aware of because those could contain the viruses, the different types of hepatitis viruses we've talked about, and other bloodborne diseases. Puncture wounds happen when a pointed or sharp foreign object penetrates the soft tissue of the body. Puncture wounds can be a result of many different types of injury, including animal bites and gunshot wounds and nails that enter into the skin from nail guns, all those types of things. So puncture wounds cause pain and usually very little bleeding. The patient may experience redness at the site, or there may be no indication of the wound other than the pain that the patients experience. So a puncture wound may not have a dramatic appearance, especially if there's a nail driven into the skin. I'm sure many of you have seen the movie Happy Gilmore, where Happy Gilmore or Adam Sandler is showing off and he is shooting the nail gun, and he accidentally shoots his boss in the head with the nail gun, and then he shows up later on wearing the nail in his head. If you look closely at that scene, the nail is in there. Hopefully the boss got a tetanus shot, but there really is nothing going on at the site of the injury other than the nail sticking out. There's really no redness, and the person who got shot in the head with a nail gun is probably going to have a nice hole in their head for a while, depending on how the scar tissue forms. But if you look closely, there's nothing really going on. And he says, well, good news, the nail's coming out next week. And then Adam Sandler makes a joke saying, you can barely notice it, but it's very noticeable. Anyways, so the redness and pain at the site is usually the featured signs that are going to be present with puncture wounds. And again, the best thing to do is just remove that foreign body, get that nail out of the head. And then once the foreign body is removed, make sure to keep that area clean and sanitized and sterile as much as possible. Lacerations occur when a sharp object cuts the skin and potentially damages the underlying soft tissue. And lacerations are usually a result of a sharp object such as a knife cutting the skin. And you can see the laceration cartoon as well as the laceration seen on the patient's body in figure B. So the edges of the cut, they may be smooth or they may be jagged depending on what object actually did the cutting. And expect bleeding. Bleeding is actually going to be proportionate to the depth and the length of the laceration. So I'm sure many of you have experienced a paper cut. That is considered to be a laceration. So with paper cuts, the bleeding is not very severe in most cases, but if you get a knife wound or get cut by a sword or something like that, then the bleeding may be a little more severe. Lacerations require prompt cleansing and repair, and when they occur with a sharp instrument, again, depending on the depth, we're going to have different severity and different types of bleeding. The diagnosis is going to be made based upon the visual examination, and a laceration with smooth edges that can be approximated cleanly is termed an incision. So you may have incision wounds on your own body, depending if you had surgeries. I have a nice incision wound on my elbow from my ulnar collateral ligament repair, and it's a very clean cut scar. It is a hypertrophic scar. It's not a keloid scar. Anything that enters a portion of the body where it does not belong is considered to be a foreign body. And common sites for foreign bodies include the eyes, which you can see in the picture here, where the patient's getting an eye flush. Also, foreign bodies can get lodged in the ears, which you see in figure A, and also in the nose, but any surface of the body, any crevice of the body essentially can be involved in foreign body lodging. So foreign bodies in the ear, like we see in figure A, they typically range from different types of insects and bugs to stones and even little bits of cotton that come off from Q-tips. So you should not clean your ear with Q-tips. Q-tips actually just push the wax further back into the ear. So anything small enough to fit in the ear canal can get lodged in the ear canal. And so the patient's going to complain of feeling stuffiness and something in the ear. If the foreign object is a bug, the patient may also complain of a buzzing sound. So anytime the patient is complaining of pain in the ear, the physician should address this immediately. You should look in the ear canal, and another sign or another symptom that the patient is actually going to be presenting with may be hearing loss or decreased hearing capability. So again, anything small enough to fit in the ear could be the offending foreign body. So the best way to treat foreign bodies is to remove the foreign bodies. So just get whatever's lodged in that crevice out. And we have to get those things out immediately because those are usually very dirty objects and they can carry bacteria on them, which can lead to infection and eventually potentially systemic infection. So it's important to remove those bodies, and if we don't remove those bodies and the patient is suffering from some type of systemic infection, it's really important to get that systemic infection treated immediately. Now we're going to move into talking about burns and different types of thermal insults. So the appearance of the skin being burned can be due to too much heat or too much cold. So we can get hyperthermia, where you're exposed to too much heat that we see in burns related to scalding water burns and fire burns, or we can get burns on the skin due to hypothermia, where the skin is exposed to very cold, severe, and harsh weather conditions for an extended period of time, like we see in skin and different areas of the body that experience frostbite. So it's important to know the differences between hyperthermia and hypothermia. But regardless of the variance in temperature, whether it's hot or cold, most conditions resulting in a severely altered state can be life-threatening if untreated. So hyperthermia and hypothermia are two conditions that need to be treated immediately. And they also need to be monitored consistently so that the patient can maintain homeostatic balance as best as possible. One of the interesting phenomena that you see in burns, especially burns due to scalding water burns or chemical burns or fire burns, is you see this hypermetabolic phenotype. And that's what you all are going to be working on in your discussion this week. You're going to be addressing why we get this hypermetabolic phenotype. And basically what's happening is the body is trying to compensate for the area that is burned and the area that is lost. So all the internal organs are going to be working harder, the immune system's going to be working harder, and you may, if the patient who is experiencing the burns, they may lose a significant amount of weight. We see a muscle wasting and a muscle atrophy in burns due to this hypermetabolic phenotype. When I was doing my postdoc at Harvard, I worked at Shriners Burn Hospital, where I worked with children who experienced severe burns, where some of the children had over 50% of their body burned due to different types, due to chemical burns, due to being in a fire, and also being exposed to hot water burns. So depending on the nature of the burn, we saw all different manifestations. Some of the patients had blisters on their skin, some had a charred appearance, some of them were just very red, some of them had a very raw skin appearance. So it all depends on the severity of the burn and what actually caused the burn. But really important to note that the patient who has experienced a burn usually has pain. And the extent of the burn, along with the percent of body surface involved, is usually related proportionally to the degree of pain. So what that means is the more of the body that's burned, the higher amount of, or the greater amount of pain that is going to be experienced by the particular patient. And also depending on the depth and the nature of the burn, that's also going to contribute to the pain that the patients experience. So again, the skin surface may be reddened, it may be blistered like we see in figure A, you can see those blisters on the patient, or it may be charred like we see in figure B. So again, I mentioned previously that burns can be caused by fire, they can be caused by chemicals, different types of radiation, or even electricity. So it's important to understand how the patient got burned and treat the burns accordingly. So the diagnosis is going to be made on visual examination as well as history. And if the burn is due to fire, it's really important to determine whether the burn occurred inside an enclosed space or out in the open, because that's going to tell you a lot about the patient's current respiratory state. So If the patient was burned inside, the patient may have inhaled a lot of smoke, so it's important to do a full respiratory evaluation. The physician is also going to determine the depth and the extent of the burns. So again, the depth, the amount of surface area, and the intensity of the burns has a tendency to be directly related or directly proportional to the amount of pain that the patient's experiencing. This picture here shows the rule of nines, and this is a common figure and a common reference that is used when physicians are diagnosing and trying to understand what percentage of the body is actually burned. So we're going to start over here on the left side. We're going to start in the adult, and you can see how the different body areas are broken down. So if we have both arms burned, so let's say we have the right arm as well as the left arm burn, each arm accounts for 4.5% of body area. So that's going to be the first 9. If both arms are burned, that equals 9%. The head is worth 4.5%. The torso is worth 18%. So the people who've made the rule of nines, they classify 9% on each half of the torso. If the genitals are burned, that makes up only 1%. And if each of the lower extremities are burned, that makes up another 9% each. In children, it's a little bit different. The child classification actually divides the arms up into a little bit different classifications. So you can see here the upper arm burn is 4%, the lower arm burn is 3%, and the legs are also classified and segmented a little bit differently. So the upper leg is a 4%, the lower leg is 5.5, and the foot is 3.5. The big thing I want you to know is about the rule of nines associated with the adult. So the adult is going to really pertain more to the rule of nines, the easy computational rule of nines. The infant up here is even more different. So the infant has a different classification to diagnose what percent of the infant body is actually burned. And I want you to discover and research what percentage of the body has to be burned in order for this hypermetabolic phenotype to be elicited. So that's what I want you to talk about this week in the discussion board. And many of us have experienced this condition known as sunburn. So being exposed to the sun for an extended period of time, causing redness, potentially blistering, and potentially leading to cancer early on. So sunburn is more common in people with lower melanocyte deposition. So people who have fairer skin, they have fairer skin because they have lower abundance of melanocytes present in their skin. People who have darker skin have a higher abundance of melanocytes and are less susceptible to experiencing sunburn. So we get a sunburn from a prolonged exposure to the UVA and the UVB rays that are coming down from the sun. And this does predispose people to skin cancer. And in the picture over here, I've listed several different types of skin cancer. And it's important to understand the differences between these skin cancers because some can look really bad and be malignant, and some could look really bad and actually be classified as benign. So for the most part, when we have the term carcinoma, this is usually going to be malignant, but there is one exception, and this does come in the skin cancer. A basal cell carcinoma that we see up here, this is considered to be a benign form of cancer. That's really important to know. Basal cell carcinoma is not malignant, it is benign. Patients who work outside or patients who are exposed to the sun for a prolonged period of time, and as they age, they may develop a condition known as actinic keratosis. Actinic keratosis is a pre-malignant condition that can result in the formation of squamous cell carcinoma over here. Really important to know, actinic keratosis is a pre-malignant condition and it can result in squamous cell carcinoma. Malignant melanoma, it's one of the most deadly types of skin cancer. So you can see that this is a very dark, very strangely shaped mole and strangely, just a strange order to it overall. So different appearances of darkness. And I always remember the ABCDEs of cancer pathology associated with the skin. That'll really help you identify and understand. Again, this is not going to be a diagnosis, but this can help with the diagnosis and help the patient understand that he or she may need to seek medical intervention, medical treatment, or medical evaluation. So the A stands for asymmetry. So the more asymmetric, the more strangely shaped, the more irregular the lesion is in particular. So if we're looking at melanoma, this is not, you see this very well circumscribed, but then there's these other patterns of brown area out here, and there's some darker black areas in here. This is asymmetric. So the color is not symmetric, and also the shape is not symmetric. This can be confused sometimes with a nevus or the mole. So just because you have a mole on your body doesn't mean you have cancer, but you should be aware of if the mole changes shape. So the A stands for asymmetry. The B stands for border. So does the lesion have a well circumscribed border or an irregular border? If it has an irregular border, that is something that we need to be aware of right away. Color. Usually the color is darker in the malignant types of cancer. However, the squamous cell carcinoma does have what's known as a pearly white papule or pearly white appearance. And just because it's not dark, it is white, this is actually still considered a malignant type of cancer. So again, this is just the ABCDEs are just a general rule of thumb. If you have any strained skin lesion, you should seek medical advice. So A for asymmetry, B for border, C for color, D for diameter. So how big is it? Is it really big? Is it really small? Diameter. And then E for evolving. Is it changing shape? Is it changing consistency? Is it changing color? So remember the ABCDEs of skin cancer in order to potentially bring this to the physician's attention. Radiation exposure is a phenomenon that some people are aware of, but some people are actually unaware that they've actually been exposed to radiation. And the pathologies and the symptoms that result from radiation exposure may not have a instant onset, that may be more of an insidious onset. So it's important to be aware of that concept and understand the different types of radioactivity that surround us. I'm sure many of you have heard of the nuclear plant incident that happened in Chernobyl in 1986. If you look at Chernobyl today, even after 35 years of not having anything in that area, there is still an extremely high amount of radiation present. There are trees growing in Chernobyl. There are animals living in Chernobyl. However, are these animals healthy? Are they having any type of mutations? With radiation exposure, this chart outlines really nicely what could happen if you're exposed to higher and higher amounts of different radiation. So radiation is known to cause mutations. Again, they may not have an instant onset. This may be more of an insidious phenomenon where the symptoms manifest many years down the road. Excessive radiation can lead to radiation sickness, where the patient experiences lethargy, nausea, and even anorexia. And radiation, basically what it does that is very dangerous is it inhibits the immune system. It inhibits both the innate and the adaptive immune system. So you can't fight off infection as well, and you can't fight off pathogens as well. The more radiation you can get what's known as hemopoietic syndrome, where you get bone marrow hypoplasia, you can get leukopenia, thrombocytopenia, and anemia. And again, the immune system is severely compromised. So 50% of the patients who die from hemopoietic syndrome die of some type of systemic infection that they simply cannot fight off. More exposure can lead to gastrointestinal syndrome, which can cause death of the epithelial cells in the gut, can cause your hair to fall out, and nausea and diarrhea within hours of exposure. And very high abundance of radiation exposure can actually cause a syndrome known as cerebral syndrome. So this can cause hemorrhagic necrosis of the brain, where the brain goes ischemic and necrotic very quickly, and the patient can suffer from convulsions, delirium, coma, and even death, depending on the amount of radiation. So this figure out here highlights really nicely different body effects that could happen due to prolonged radiation exposure. So go through these and make sure you understand how dangerous radiation exposure can be. When I was working at Mass Gen Hospital, I did work with radioactive isotopes. I worked with 18 FTG, and we basically injected this into the tail vein of our rats in order to look at how glucose utilization was changed after we did this particular type of surgery known as Roux-en-Y gastric bypass surgery. So because I was working with a radioactive chemical, I had to wear a radiation badge. And with the radiation badge, I had to turn in it every Friday, and it would get read by a machine, and then I would get a report of how much radiation I was exposed to. So I know my radiation amount. Many people do not know how much radiation they're exposed to. Really interesting read about the Canadian shelf that happens to cause radiation exposure. The radiation came from a volcanic eruption that occurred in the far western coast of Canada, and people all the way out in New York City were suffering from radiation sickness due to the radiation that was released from the volcanic explosion. Electrical shock is a type of injury that occurs as the result of exposure to or contact with electricity. And people who have experienced electrical shock may have experienced cardiac or respiratory failure. People who have electrical shocks, they may have a visible burn at the entrance site. And if they are still conscious, they may experience pain at these particular sites. With electrical burns, it's very common to have charred tissue as well. Individuals who suffered from electrical shock may be experiencing a life-threatening emergency. So electrical shock due to lightning, electrical shock due to being tased an excessive amount of times, patients need to be evaluated because this can be a life-threatening emergency. The cardiovascular system could shut down and the patient could die. Resuscitation and life support may be required during the transport to the emergency department. So the diagnosis is going to be made upon the visual exam and the patient history. And the prognosis really varies. It depends on the extent of the injury and how much damage has actually occurred to the organs and our body if we suffer electrical shock. If the patient's in cardiac arrest, the prognosis may not be favorable, even if the proper resuscitative efforts have been made. And it's very important for you to realize that the electrical energy will follow nerves along their path through the body. And so with electrical shock, there is the potential to damage the peripheral nervous system. Hyperthermia occurs when an individual's core body temperature rises above the normal homeostatic level of 98.6 degrees. So accidentally occurring hyperthermia is the consequence of prolonged exposure to extreme environmental heat. We see heat exhaustion and we see heat stroke in patients who are suffering from hyperthermia. And we've seen many people in the state of Florida where I live, young people die of heat stroke, especially those who are practicing sports outside and not consuming enough water and not being cooled off appropriately. So this figure on the right side of the screen highlights the differences between heat exhaustion and heat stroke nicely for you. Heat stroke is obviously more severe than heat exhaustion because people who are suffering from heat stroke may actually lose consciousness, while with heat exhaustion, the most severe things that you're going to experience are muscle cramps, fatigue, and diaphoresis or extreme sweating. But if we go into a heat stroke again, this occurs when the body temperature exceeds 105 degrees Fahrenheit, and this is a life-threatening emergency because of everything that's going on. So patient may complain of a headache, general confusion. The sweat response may be absent. The heart is going to start to beat rapidly. The patient may experience nausea and vomiting, may have this really hot red skin experience, and may lose consciousness. The patient loses consciousness, it's really important to get medical attention because you are potentially rendering the patient more and more susceptible to brain damage the longer the patient is not treated. So brain damage and death can result from a heat stroke. So again, the first thing to do is call the emergency service and then take immediate action to cool the person. If you have ice packs around, if you have an ice bath around, it's really good to stick the patient in an ice bath until the appropriate medical team arrives at the scene. On the opposite end of the spectrum, when we are experiencing extreme cold for a prolonged period of time, we can suffer from hypothermia. Hypothermia is different from frostbite. Frostbite and hypothermia are compared in the figure here. If your core body temperature drops below 95 degrees Fahrenheit, it's important to get medical attention immediately as well, just like we saw with hyperthermia. It raises above 98.6, especially if you're in that above 105 degree level, you can start to experience severe pathologies with the brain, so you need to get treated immediately. So with hypothermia, what's the body going to do to try to compensate? The body's going to shiver, the body may turn numb, and the patient may suffer from loss of coordination, strained speech, and general disorientation. The skin may turn a cyanotic color, so it may appear blue, and the pulse is going to become very slow and weak. Again, if the core body temperature drops below 95 degrees Fahrenheit, this is another medical emergency. Instead of the extreme sweating that we see with heat exhaustion, we are not going to see any sweating with hypothermia. We're not going to see any rapid breathing, but the breathing is going to be very shallow and very slow. Another thing you may notice about the patient is the patient's going to have dilated pupils. And both frostbite and hypothermia are issues that need to be addressed because frostbite can lead to appendages having to be removed or excised because we do not want to impede blood flow. Perfusion to frostbitten areas may result in amputation in order to save the patient, depending on the severity of the frostbite. If the frostbite occurred in the entire leg, well, then the leg may have to be amputated in order to save the patient's life. Now we're going to move into talking about bites, and bites can come from any type of organism, ranging from insects to humans and everything in between. So domestic animals, reptiles, anything that has teeth can actually bite. Cats, dogs, things like that. So again, they range from the annoying insect bite to bites that can cause a lot of tissue ischemia and necrosis. And that's what we actually see in this figure 15.18 up here. This is a bite that's occurred from a brown recluse spider, one of the most venomous spiders in the world. This is a venomous spider that is native to both Florida and Georgia, the brown recluse. Definitely, if you have a brown recluse spider bite, it's something that you need to get checked out immediately because this is just going to get worse and worse and can spread throughout the tissue. So it needs to be treated immediately. Some people, like we see down here in figure 15.19, living in Florida and Georgia, you have the infamous pest known as fire ants. Fire ants can induce anaphylactic reactions and anaphylactic shock in people. So I get bit by fire ants basically every single day when I walk outside barefoot. They're always around, no matter how much you treat the lawn, they always tend to find a way to bite you. Luckily, I don't have a severe reaction to fire ants. I don't require any type of EpiPen, but some people do. Some people need to take a shot of epinephrine due to the potential of going into anaphylactic shock. Getting bit by certain things such as mosquitoes. Mosquitoes can transmit deadly viruses. Mosquitoes can transmit the dengue fever, the West Nile. And then there are some animals that have venom in their saliva, like the Gila monster, a type of reptile. If the Gila monster bites you, then you can have ischemic and necrotic tissue that forms very, very quickly. So the signs and symptoms are going to vary depending on the source of the bites, but usually the patient is going to be experiencing some type of sharp or stinging pain followed by itching, redness, or swelling at the site. And the allergic reaction can progress into edema, dyspnea or difficulty breathing, weakness, nausea, shock, and even can lead to unconsciousness and death if not treated appropriately. Rocky Mountain spotted fever is a pathology that results from a tick bite. So this is a tick-borne disease that results in severe systemic infection, and the pathogen is Rickettsia rickettsii. listed right there. So a few days after, up to 2 weeks after the patient's bitten by a tick, the patient may start to experience a headache, a general vague fever. Patient may also experience nausea and vomiting and general fatigue and muscle pain. So you get tick bites from being outside in the woods for extensive period of time. As the name implies, Rocky Mountain spotted fever occurs predominantly in the Rocky Mountains in the Colorado region. So 4 days, the fever is usually the first thing that's going to onset and first thing the patient's going to experience. But 4 days after the fever, they get what's known as a maculopapular rash, which you see in the patient here. This is the Rocky Mountain spotted fever rash on the patient's forearm right there. Can have vascular issues, vasculitis that affects the skin and other organs. And the lab findings, there's a specific test where you get a positive complement fixation reaction. Luckily, the treatment with either tetracycline or doxycycline is a very effective treatment to rid the patient of the disease known as Rocky Mountain spotted fever. And a good thing about Rocky Mountain spotted fever, once you get it, you can never get it again because our naturally acquired immunity is a lifelong protector. So you can only get it once. Even if you get bit with the tick that is carrying the pathogen, you cannot get Rocky Mountain spotted fever again. Pretty cool. As I mentioned a few slides ago, insects, especially mosquitoes, can carry different types of disease. And malaria is a disease that is contracted from a mosquito bite. So the mosquito actually has to be infected with another organism, Plasmodium, which is a type of protozoa, and then the mosquito injects the protozoa into the victim in which it bites. What this does is it goes directly into the bloodstream and it affects the liver, it affects the red blood cells, and it causes havoc in the body. So patients who suffer from malaria, they experience this classic cycle of chills, fever, and sweats, especially night sweats. Other symptoms that the patients may complain of include headache, nausea and vomiting, fatigue, and myalgia. Luckily, malaria only lasts about 1 to 4 weeks, and in most cases it resolves. But again, people do die of malaria every single day. If it affects the spleen and affects the liver simultaneously, the patient can get a condition known as hepatosplenomegaly. And this is just general enlargement of both the spleen and the liver. And because it's affecting the red blood cells, the patient can suffer from anemia. And then the symptoms have a tendency to recur and may actually persist for many years to come. This has to be diagnosed via lab test. Luckily, we have a pretty good treatment for malaria nowadays. Chloroquinolone and the quinolone drugs are a very good treatment to alleviate the symptomatology associated with malaria. And then there are many different types of dangerous chemicals that may be found in the house, may be found in the lab, but these are different types of chemicals that you should definitely avoid. So this table 15.1, highlights some of the common chemical toxins that are present in the domestic setting. Methyl alcohol or methanol. You should not be drinking methanol. You should drink ethanol if you are trying to consume any type of alcohol. Don't encourage you to drink alcohol either. But if you do drink methanol, this is very, very dangerous because it can render you into a state of metabolic acidosis and cause neurologic damage, which can result in immediate and irreversible blindness. Same thing with ethylene glycol. That is very, very dangerous. Ethylene glycol is found in antifreeze, which could cause the kidneys to shut down and basically tubular necrosis to happen as well. Carbon tetrachloride. This is a very dangerous chemical that can result in renal failure. Carbon monoxide, sitting in the garage with your car on and the car just running in an enclosed environment can render you susceptible to carbon monoxide poisoning and even death. So basically what happens is all of the oxyhemoglobin in your body is displaced with carboxyhemoglobin, and eventually you are going to slip into a coma and death as more and more oxyhemoglobin is replaced with carboxyhemoglobin. Now we're going to switch gears a bit and talk about some pathologies that are known as cumulative trauma pathologies. These pathologies result from repetitive motion or different types of overuse. And one of the most common ones is listed on this slide here, known as carpal tunnel syndrome. So basically what happens is there is entrapment and compression of the median nerve in the carpal tunnel. And this causes pain and numbness in the patient's wrist, hands, and fingers. So the numbness that the patient experiences can lead to a lot of discomfort and pain that's really pronounced at night. The wrist or hand may swell, and the patient is often seen cradling the arm or rubbing the hand or the arm that is affected. Sometimes by simply shaking the hand, the patient can get temporary relief. So you may see the patient shaking his or her hand. The tendons, the blood vessels, and the median nerves pass through a narrow fibrous tunnel that extends from the wrist to the hand. And that's what you see in the picture here. And again, this is entrapment of the median nerve. It's not the radial nerve, it's not the ulnar nerve, it's entrapment of the median nerve specifically. So this syndrome results when the tendons within the tunnel become inflamed from repetitive overuse of the hand. So people who spend excessive amount of times on computers typing, and people who are using their hands a lot in their job may suffer from carpal tunnel syndrome or overuse, repetitive use of the hands and the fingers. Video gamers may suffer from carpal tunnel syndrome. So basically what happens is, again, the compression and entrapment of the median nerve occurs as it passes through the wrist, which results in the pinching of the median nerve. And this has to be diagnosed by the clinician, and the clinician is going to do several tests, two of which include the median nerve percussion test, where the physician may tap his or her fingers along the inside of the affected patient's wrist for percussion. And that may elicit pain, that may elicit twitching, things like that. Also, another test that the physicians may use is known as the Phalen wrist flexor test, or the Phalen wrist flexor test. Lateral humeral epicondylitis is a fancy medical term for the condition known as tennis elbow. And as you can imagine, this occurs in people who play tennis, along with other professions and sports, but most commonly seen in tennis players. And this is the result of repetitive movement involving flexion of the wrist against resistance. So the result of this repetitive action is an inflammatory condition of the tissue at the distal portion of the humerus. And so the patient may, one of the most common things that the patient is going to suffer from is weakness in the affected extremity. So the extensor attachment to the lateral humeral condyle becomes inflamed. And as the patient uses the arm more and more and undergoes repetitive motion in the elbow, this causes excessive stress to the joint, which further elicits the inflammatory action of this particular condition. So the diagnosis is going to be made by evaluating the clinical findings upon physical examination. The treatment is to encourage the patient to stop doing the repetitive task and rest the affected arm. Sometimes NSAIDs are prescribed and ice packs are applied to the affected area. Those are helpful in decreasing the inflammation. And sometimes the physician may actually inject steroids into the joint space to provide the patient with quick relief. Physical, psychological, or sexual injury to a child is considered to be child abuse. The most commonly observed form is physical abuse because the resulting injuries are usually very apparent. Unfortunately, sometimes these injuries may not be apparent because the injuries may be concealed by clothing. Signs of psychological abuse may be evidenced in the actions of the child. And sexual abuse may be discovered incidentally and investigated when the child complains of discomfort in the genital region or if the child actually reports abuse themselves. It's important to note that neglect is also considered a form of child abuse. So children who are neglected can suffer many different types of psychological issues as well. Often children who are victims of child abuse are identified by teachers, daycare providers, or healthcare providers. These can also be the perpetrators who are causing and doing the abuse to the child. So that's something to be aware of. And child abuse and neglect can be a result of many different causes. What you see in the pictures here, in the top picture, you see typical marks of a child being abused. So you can see the bruises on the arms in the pattern of fingers. You can see belt marks, so this child was obviously hit, and you can see cigarette burns. So sometimes, unfortunately, adults will maliciously burn children, and you can see the round circumscribed lesions on the child. In this picture, you can see the cigarette burns on the child's gluteal region. Also, children can suffer burns very easily. Sometimes if the bath water is too hot, the child can suffer from severe burns. That's what we see in figure A, and in figure B, we see the scalded dip burn as well as a scalded child. So we can see this extreme irritation, extreme erythema, and this could lead to blistering and prolonged skin healing. Shaken infant syndrome, or SIS, is also known as shaken baby syndrome, or SBS. And this refers to the injuries incurred by the infant or toddler who has been shaken forcibly enough to cause intracerebral bleeding, resulting in a closed head injury. So, very important to be able to recognize this. This is a severe form of child abuse. The shaken baby may experience altered levels of consciousness to complete loss of consciousness. The child may display irritability, and you may notice changes in the skin color that range from paleness to cyanosis. The child may also be experiencing nausea and vomiting, lethargy, and seizures and convulsions. Most of the time, there's no outward indication of physical trauma, but fractured and dislocated bones can be found on physical exam and diagnostic radiographic imaging. Examination of the eyes may reveal retinal hemorrhages, and that's what we see in the picture here. We see some retinal hemorrhages. And babies shaken into unconsciousness are often put to bed in the hope that the injury will resolve. So a lot of new parents, a lot of parents who are very frustrated and don't know how to deal with a crying child, unfortunately, shake the child out of frustration and anger, and children are very susceptible to injury. The infant and the toddler skull is very, very fragile. And if you ever had a newborn baby, you can feel the fontanelle or the soft spot on the baby's head, and it remains relatively soft all the way through the first year of life, sometimes through the second year of life. So the skull and the brain is very, very fragile. You should never shake a baby. You should never shake anybody in general. And in order to identify where the hemorrhages are occurring, the patient may suffer from different type of hemorrhages, different type of bleeding. The patient may experience a subdural hematoma. We talked about the differences between the subdural and the epidural hematomas in the previous chapters. Patients may also experience cerebral edema. So in order to diagnose and definitively know where these issues are occurring, the physician may order a CT to help identify the locations. Elder abuse and neglect take on different forms. There's physical abuse, where the victim is actually experiencing abuse from another person. There's self-neglect. As people age and people become more withdrawn from society, they tend to neglect their general hygiene and their general well-being. There's verbal abuse, psychological abuse, abandonment, violation of personal rights, as well as financial abuse. Financial abuse is something elderly people are very susceptible to because of their general lack of knowledge of how the financial system and the financial era is developing, especially in the forms of digital currency, cryptocurrency. There are a lot of scams going on. There are a lot of robocallers, especially since the onset of this COVID-19 pandemic. A lot of phishing and spear phishing attacks happening. A lot of elderly people are becoming victim to those as well. So those are all things to watch out for. It's also important to note that it's very rare for an elderly patient to report or complain of abuse, and evidence of the abuse is usually discovered during examination for another purpose. Intimate partner violence, or IPV, is the result of threatened or actual physical abuse, and it's a pattern of behavior in which the victim is repeatedly physically assaulted by his or her partner. And other terms for IPV include domestic violence, spouse abuse, as well as battered spouse syndrome. And victims of IPV can be in either heterosexual or homosexual relationships, and unfortunately, the victims who are most commonly suffering from IPV are women. Women tend to be threatened by men in a lot of cases with IPV. We're going to talk about the dominance and the psychological issues that come with rape and other types of sexual abuse and trauma. So with IPV, the person who is the perpetrator committing the IPV may threaten the spouse that if they report what's going on to the authorities, the partner violence may become even more severe. So a lot of people just feel threatened and very scared to even report this. Things that you notice, same thing that we talked about in the child abuse, bruises and other signs of trauma, but unfortunately, just like we talked about with the children, these bruises and other signs of trauma may be concealed by clothing, so sometimes it's difficult to diagnose. And it's a complex issue with no specific cause. So what I mean by that is there are a lot of different issues that go into why people commit IPV. There is a theory about the stress levels in the patient or the person who is committing the IPV. So the higher stress levels, people with higher stress levels tend to become more irritable, more violent, more angry. So stress has a direct correlation to IPV. And again, diagnosis is going to be based upon the information that the patient provides as well as physical examination. Any form of non-consensual sexual content or activity is considered to be sexual abuse. And it may involve either gender and it may be perpetrated by either gender. Another important factor for you to be aware of is that the victim of sexual abuse may be of any age, ranging from infant to an elderly person. So sexual abuse takes on many different forms. Any form of non-consensual sexual activity can be considered to be sexual abuse. So some examples include fondling of the genitals or the breasts, penetration of the vagina or rectum with fingers or other objects, and forcing the victim to touch the perpetrator on or around the sex organs. And just like we saw with IPV, sexual abuse is a very complicated matter. There could be threats involved. There could be a lot of other situations involved with sexual abuse. And the diagnosis is going to be made based upon a very detailed patient history along with physical examination. Rape or sexual assault is intercourse that's forced upon a person against his or her will. And the symptoms and signs of rape or sexual assault are going to vary with the degree of violence that's incurred by the victim. Many patients are going to go directly to the ER or to the police or the physician's office and state that they've been raped. Some are going to report having pain in the pelvic and perineal regions, and some may even report being abused, such as being choked or restrained in some manner. Others are going to report that they've been threatened, had death threats given to them, and the physician may notice that there's bruising in any area of the body, not just the pelvic region. Other signs of rape include torn clothing, dirt and debris on the body, a disheveled appearance, withdrawal, anxiousness, avoidance of eye contact, and bruising, and also issues and inflammation around the genitals. Many rape victims will go to or be transported to an emergency facility for a sexual assault exam, which includes gathering of any evidence. And urinalysis and DNA sampling may be beneficial in helping identify the perpetrator. And unfortunately, the very last thing that we're going to be talking about this quarter is suicide. So suicide is taking one's own life or intentionally causing one's own death. And individuals who are contemplating suicide may appear depressed, or they may be making remarks about how they look forward to dying or ways that they're going to carry out how they're going to kill themselves. So we talked about depression. Depression does not people do not need a reason to be depressed. Depression is a real thing. It is a neurological imbalance of neurotransmitters in the brain. And again, you do not need a particular reason to be depressed. Watching out for suicidal tendencies. We talked about suicidal tendencies in chapter 14, but anybody who's given away their personal possessions that they value, that is a red flag warning sign. And again, like I mentioned previously, talking about or contemplating suicide, especially doing research of the best ways to kill yourself, those are red flags as well. The patients may also be experimenting with different types of drugs and substances that he or she hasn't experimented with in the past. And depression that eventually leads to suicide is multifactorial in most cases. Suicide is a permanent solution to a temporary problem in the vast majority of cases. And unfortunately, suicide is irreversible.